Losing a tooth takes a heavy emotional toll. It dictates how you speak, what you can comfortably eat, and whether you feel free to laugh around your friends and family. Many people assume that losing a molar in the back of the mouth, where it remains hidden, is a minor issue that can be safely ignored. That assumption ignores the mechanical work of the human anatomy. A natural tooth root sends vital physical stimulation into your jawbone every time you chew. When that natural root is gone, the daily signaling stops. Your body registers the lack of pressure and begins to reabsorb the bone tissue in that specific area. This process triggers a specific biological chain reaction. As the bone density drops, your cheeks can sink inward, creating a prematurely aged appearance, while your remaining healthy teeth tilt toward the empty gap. A missing tooth is a structural deficit that actively degrades your facial anatomy and your long-term chewing efficiency. Most dental marketing presents implants as a straightforward, perfect smile solution. This contrasts with cheaper, non-surgical alternatives like traditional removable dentures or dental bridges, which offer an immediate visual fix. Choosing an implant involves a premium financial cost, a multi-stage surgical schedule, and the placement of a titanium post directly into your jawbone. Does the long-term benefit of this procedure actually justify the physical discomfort and the expenditure? To find the answer, we must evaluate dental implants as a rigorous, long-term infrastructural investment in your body. Successful dental restoration relies on a multi-month biological timeline. The process begins with 3D CBCT scans to map your nerve pathways and jawbone viability before moving into the surgical placement phase. During surgery, a surgical-grade titanium screw is placed into the jawbone to act as an artificial tooth root. This initiates osseointegration, where your natural bone tissue grows around and fuses to the microscopic grooves of the metal. This fusion phase requires 3 to 6 months of patience and gentle care while the bone and metal become a single unit. Once that connection is rock solid, a dentist attaches the abutment and a custom porcelain crown to complete the restoration. Accepting this period of delayed gratification secures a permanent foundation that is structurally stronger than a natural tooth. Existing jawbone density is the biggest variable that can alter this standard schedule. Patients who have been missing a tooth for several years often lack the bone volume required to hold a titanium post safely. These cases require bone grafting, a preparatory surgery that adds bone material to build a solid foundation. A bone graft changes the timeline significantly, adding a 3 to 4 month healing block before the actual implant surgery can begin. This adds months of waiting and increases the overall clinical bill. While it adds massive upfront friction, a graft is a non-negotiable prerequisite to ensure the implant survives heavy chewing pressure. From a strictly financial perspective, the premium upfront price of a dental implant is often intimidating. This is frequently compared to the low upfront cost of traditional removable dentures. However, projecting these costs over 15 years reveals the hidden expense of the cheaper option. Removable dentures require specialized cleaning solutions, adhesives, and frequent clinical adjustments. Because dentures do not stop bone reabsorption, the jaw continues to shift, forcing a complete denture replacement every 5 to 7 years. This cycle of repairs and replacements eventually exceeds the one-time investment required for a successful implant. Implants provide a superior financial ROI because they are a permanent capital expense that halts the ongoing subscription cost of denture maintenance. For patients facing total tooth loss, the sheer cost and complexity of replacing 32 individual roots is a significant barrier. The all-on-4 protocol is the engineering solution to this problem, designed for full mouth restorations. This matrix compares the mechanics of single tooth replacement against the all-on-4 full arch strategy. Instead of dozens of implants, this method uses 4 strategically angled titanium posts to securely anchor an entire upper or lower set of teeth. The specific angle of these posts often allows surgeons to bypass areas of low bone density, eliminating the need for months of bone grafting. The all-on-4 protocol offers the highest functional ROI for patients with total tooth loss by concentrating a full restoration into a single surgical event. It is important to note that implants carry specific exclusionary criteria and are not a universal cure-all. The primary biological deal breakers are uncontrolled systemic conditions, such as advanced diabetes or severe periodontal disease. These conditions compromise the immune response and can prevent the bone from fusing with the titanium. There is also a major behavioral risk factor: heavy smoking and vaping. Nicotine restricts blood flow to the gums, starving the surgical site of nutrients and significantly increasing the risk of implant failure. Proceeding with the surgical investment while ignoring these risk factors turns a predictable medical procedure into a dangerous financial gamble. Selecting a restorative dental path requires weighing upfront effort and cost against the long-term biological payoff. This chart maps these options based on their immediate requirements and their permanent impact on your health. Healthy individuals looking at a 20-year horizon should accept the initial friction of implants for the unmatched biological return. For those with total tooth loss, the all-on-4 strategy provides a definitive escape from the ongoing discomfort of dentures. If financing is not currently an option, utilizing cheaper restorations like bridges is a necessary step to avoid the risks of neglecting a gap entirely. Dental implants demand immense physical patience and financial capital, but they remain the only restorative choice that actively preserves your jawbone, making them a lifelong investment in your structural health.